We had a topic today, patient prosthetic mismatch in aortic valve replacement. So I would like to ask you, sir, what do you mean by this? What is this?
Patient prosthetic mismatch in patients with aortic valve replacement means that for a patient with a large body surface area, a relatively small sized aortic prosthetic valve has been implanted.
Okay.
And that results in a disparity between the patient's body surface area and the patient's valve area.
Right.
That means the valve area falls too short or too small for that body surface area, and this is called patient prosthetic mismatch.
So, sir, how it happens and why it happens?
Yeah, that's a good question. Normally, a patient, we normally believe and assume that a patient who has got a larger body surface area will also have a larger left ventricular outflow tract diameter.
Okay.
But in many patients, almost as 15 to 20% patients with even large body surface area, the aortic valve outflow diameter may be small, much smaller than expected.
Okay.
And then the surgeons are forced to implant a smaller size prosthesis, and this results in patient prosthetic mismatch.
Okay. And how commonly you see, sir, in your practice?
In my practice, we normally patients who undergo aortic valve replacements are generally older patients, because in our country as well as in the West, the commonest cause of aortic valve replacement is aortic stenosis, right? And aortic stenosis usually occurs after the age of 55 to 60. But in our country, peculiarly, rheumatic heart disease being very common, rheumatic heart disease being very common, even younger patients between the age of 30 to 50 do undergo aortic valve replacement either for aortic stenosis or for regurgitation. And we in our country, as you know, as compared to our Western counterparts, have much smaller body surface area.
Right.
Indians are generally thin people,
Right.
Thin like me, let me put it that way. So in that event, the aortic valve implanted will be smaller, in a smaller diameter or a smaller size, and that results in patient prosthetic mismatch. In my clinical practice, as many as 15 to 20% people who undergo aortic valve replacement have patient prosthetic mismatch.
That sounds a little bigger number, right, sir?
That's a big number. That's a big number, and I'm quite sure that when you talk to many other cardiologists and cardiac surgeons, they will confirm this. But this, out of this 15 to 20%, that patient prosthetic mismatch becomes severe, of a severe variety. That can be also graded as moderate or mild, moderate and severe.
Right.
Its severe variety occurs in only 5% of people.
Okay.
Yeah.
So what happens to these patients, sir, who are presenting with a mismatch?
Yeah. Mismatch means for a patient with a large body surface area, you have implanted a smaller valve.
Right.
So when the heart ejects the blood,
Right.
the blood will face obstruction at the level of prosthetic valve,
Right.
producing a lot of strain and stress on the heart. And this has been shown in literature to increase 30-day mortality and also 15-year long-term mortality in these patients. So the mortality goes up.
Okay.
And the patient's symptoms don't get regressed.
Right.
Why did the patient first come to the hospital? Because he was getting dyspnea or breathlessness on exertion.
Right.
And now even after valve replacement, he continues to be breathless. Less breathless, but his symptoms don't completely disappear.
Okay.
So symptomatically he may not benefit as much
Right.
as he would have
Right.
if he would have received an adequate size prosthesis.
Agreed.
Right.
So, sir, for these patients, how do you manage? What the future direction for them?
Yes. See, there are two issues. One is a patient who is going to undergo valve replacement.
Right.
Now, in him, first important is to measure the left ventricular outflow tract diameter on the echocardiography extremely well.
Okay.
Number two, choose the prosthesis size extremely well. There are different manufacturers in the market. St. Jude, Medtronic, Sri Chitra valve is also there. So each manufacturer for a given aortic valve size, there is a given aortic valve area. So suppose you have a patient of 1.5 meter square body surface area. For him, you will require a prosthesis which will give a valve area of minimum 1.7 centimeter square. So you have to choose the prosthesis of that size.
Right.
And suppose, God forbid, that patient aortic root is very small,
Right.
then the surgeon has to do innovative or literature described widening of the root.
Okay.
And there are some root widening procedures described called Nix procedure or Kono-Rastans procedure. They are little difficult procedures, but in the city of Mumbai also there are a couple of competent surgeons who are doing this procedure to widen the aortic root so that the aortic root takes a larger aortic valve in size.
Okay.
Yeah.
That sounds interesting. And in your hospital, sir, how commonly you are doing this kind of surgeries?
Let us say around 5% of people require aortic root widening procedures.
Okay.
And the other side of the story is a patient who has already undergone surgery.
Right.
He has got a small valve
Right.
now, and the valve is become too small for him, and he is
Right.
symptomatic.
Right.
Then you have no choice than to control him with medical therapy as much as possible.
Okay.
And still the symptoms are not regressing. Then they may need redo surgery.
Okay.
In fact, in the last 5 years in my hospital, 7 people have needed redo surgery like this
Okay.
because the previously implanted valve somewhere else was too small.
Okay.
Yeah.
So medical therapy and widening of the
Aortic root.
These are the two modalities of the treatment.
Absolutely.
Right, sir. So, sir, if I request you to summarize your talk and your topic in 2-3 key messages, what would be that, sir?
Yes. The first key message is patient prosthetic mismatch is a reality in Indian population. It happens. Severe patient prosthetic mismatch occurs in 5% of people who undergo aortic valve replacement. The patient prosthetic mismatch is an adverse prognostic marker for survival after aortic valve replacement, and the best way to avoid it is to choose the correct size aortic valve for that given body surface area right when you begin to put the valve. And if by any chance the patient's aortic root is too small, then the aortic root widening procedure should be done during index surgery, during the first surgery itself.
Okay.
Because in second surgery it becomes very difficult because at that area fibrosis already occurred.
Right, right.
All right.
Right. That's a very important key message, sir. Thank you very much. I think our audience will get a lot of insights from your talk and your discussion. Thank you, sir.
Thank you very much.
So I would like to ask you, sir, what do you mean by this? What is this?
Patient prosthetic mismatch in patients with aortic valve replacement means that